So what all do we need to dissect the prawn? We will be needing a dissection board, which is usually a soft wooden board. If you cannot do it at home, then any thermocol sheet, flat thermocol sheet, or even a cardboard sheet would do, on which you can pin the specimen. You need some pins here, a blade, scissors of different gauges thickness, sharp forceps. You can see how narrow the tips are. Good quality needle with a very sharp tip here. If you are using a wooden board, then you may need a hammer or any improvised material to actually to fix the pins hard onto the board. Then you will need a tray with water. So here I am using a basin which I found in my kitchen because I did not have anything. If you're anything else, if you're squeamish about handling the animals with your bare hands, then you can use discardable gloves. And then for the display, you will need something like this. So I experimented with various materials here. This was from an old brush, and this one was from a plastic rope, and this one is black paper, thick black chart paper, and I found that this one was the best. This one was giving the best result. So these are the basic materials which you should have along with the prawn. The prawn is essential along with the prawn. Thank you. So we'll start with the prawn nervous system. The first step is, like, you just wet a paper on one side like this, and then just stick it on to the dissection board, so it will stay put like this. Don't forget to write your name, your register number, and the question number in case you are doing your examination. So once this part is ready, we will go to the dissection part. So we all know that this is the prawn. This part is the abdominal region, and this part is the cephalothorax region. What I am going to do right now, the second procedure is in case you have a fresh prawn or if it is not very preserved. In that case, this entire region will be very soft, and if we try to remove the carapace that way, maybe it may not be very easy. So what we could do is, we could pin the prawn on the sheet which we have already prepared. So we have to lay the prawn very straight. You need a needle like this, and this end part, which is known as the telson, this last conical ending, you have to actually pin it here. So when we use the pinnings, whenever we are pinning any specimen, make sure that the pins are all facing outward. The pins are all facing outward. You can use a hammer to nail it in. If you are trying to do this practical at home, then instead of using a wooden board, you can use a thermocol if you are doing it just for practice. So that way you would not need to use a hammer and all these equipments. Then, like I said, the brain lies just around this point. So one of the methods is to pin just below the eye. But when we do that, sometimes what happens is you may pin through the eye, especially if you do not have enough practice. So what we are going to do is, we are going to take the antenule and the exopodite of the antennae, and we are going to pin it together. So that way it will be easier for us to trace the nerves also, the optic nerves which you are supposed to trace. So now the next step is to make a cut. So a rough rule is, if you're having a prawn of this size, because the ventral nerve cord is lying at the bottom along the on the floor of the lower wall of the body, it would be around this you have to cut using at least half of the length of a blade. So we start cutting. If you cut very less, then it will be very hard for you to dissect. If you are not cutting deep enough, that would be a problem. But if you are cutting too much, then you may risk injuring your nerve cord. So I have made a straight cut along the vertebral dorsal line of the body, and I'm just using my fingers to pry it apart like this. Usually you may see a black cord like this on the top. Okay, this is continuous. It's broken now, but it is usually continuous. This black cord is actually the alimentary canal. So that is not the nervous system. As soon as you cut open the dorsal part of the prawn, you may be seeing the black cord, and that blackish cord is actually the digestive system. Okay, that is the digestive system. That is something which we have to remove. Actually, if you are looking close enough here, you can see the nerve cord here. You can see the small nerve cord here. Now all you have to do is, you have to make sure that the nerve cord is not broken. Okay, when you are cleaning, make sure that the nerve cord is not broken, and when you start pin in such a manner that the muscles of the body wall, the muscles and the exoskeleton, they stay away from the main dissection part. So while you are doing this, make sure to keep the interior of the prawn moist. When you are moistening it, it will ensure that the main parts, they are not brittle, they don't dry up and they do not become brittle, so that you accidentally break them. If it's very dry, then automatically there is a chance that they will break. So now all we have to do is just disconnect this muscle fibers. Just follow the nerve and disconnect the muscle fibers. So this part is very easy actually. Just make sure you don't break the nerve and just disconnect. And as you do, as you do this disconnection, just ensure that you are not breaking the body of the prawn, and you are just pushing the muscles aside. There is no need to remove the muscles. If you are cleaning it too much, if you are trying to clean it too much, what happens is that you may just break the integrity of the prawn body and accidentally cause it to break. So one of the problems of pinning the prawn on the antennules or on the exopodite of the antennae is that this pin may come loose. So you have to be extra careful when you are doing that. But for a beginner, it is always better to follow that procedure. So once I have exposed the nerve here, I am using my pinning technique to make sure that the body wall and the muscles are, the bundles of muscles, they are staying away from the nerve. So that way, without using too many needles, you are able to keep the nerve cord exposed. So as you come towards the lower part of the body, the nerve cord makes a small shift here. It doesn't go straight here. It has a small shift here. So here you should be a little careful when you're trying to trace out. That we will do at the end. So now I'm going to the harder part, because here the muscles are slightly more thickly laid. So it is a bit difficult for us to move it apart. And you can see here, this is the Hepato Pancreas. This is the Hepato Pancreas, this loose mass. In some of the prawns, you may be seeing this as a yellowish reddish mass. So that also we have to remove. So to remove that, I am just keeping it back into the water bath, and I am just washing it clean.